We are going back in time, let's say 100 years ago, to the turn of the 20th century. Our world was a very different place then. There were 1.5 billion people on the planet, and life expectancy was only 31 years. But due to rapid changes in medical science, this would soon change. To begin with, it was the discovery of the germ theory in the late 19th century that led to cures for many infectious diseases. Advanced research centers opened in the early 20th century, and by the mid-20th century, the medical landscape was characterized by new drugs and vaccines, such as antibiotics. Soon these advances, along with developments in chemistry and biology, medical technology, and genetics, led to modern medicine. But it was a series of studies concerning the education of health professionals that ignited some of the most revolutionary developments in healthcare. Integrating the modern sciences into education and equipping health professionals with the knowledge that produced one of the greatest human success stories, the doubling of our lifespan. Suddenly, our world was experiencing an influx of inhabitants, more people living twice as long, and these people are adopting problematic consumption patterns. On top of our old health concerns, new lifestyles are bringing additional health risks. But today, many poor and remote populations still lack access to basic services. And we face ever-increasing commercially driven practices. Whatever successes we have achieved in the past, all is far from perfect. The education of our health professionals has been static, inflexible, and unresponsive to contemporary challenges. It is getting old and outdated. Here's the problem. Worldwide, we are training about 1 million new health professionals every year, but these professionals are not evenly spread. For example, these 57 countries have less than 2.3 doctors, nurses, and midwives per 1,000 people and are considered in critical shortage of human resources. That's 1 doctor or nurse for every 440 persons. Considering these vast imbalances, inequitable burdens of disease is not surprising. Now look at our total global health expenditure. And this is what's being spent on professional health education. This is less than 2% of health expenditures worldwide. All of these factors are causing a great strain on the health system. The challenge is how we, the health education professionals, can both revitalize our profession and bridge the health equity gap. The solution lies for a great part in transforming the way we teach our medical professionals. But this change is not possible without ownership and acceptance from leaders, the public, and the health professionals themselves. Central to the solution are the health workers. They are the essential and crucial link to keeping the entire organism working, the heart that keeps this body alive and kicking. These are the service providers who link people to technology, information, and knowledge. They are also caregivers, communicators, and educators, team members, leaders, and policymakers. We, the healthcare workers, can be the instruments for change. The Lancet Commission recommended reform in some key areas, the most important being competency-based education, teamwork, IT-facilitated learning, and more effective partnerships between the health and education sectors. In this digital age, we now have new tools available to help us with this change. The opportunity for learning today is unique. Along with the rapid change in health, there is a parallel revolution in education. An explosive surge of information and easier access to it has also resulted in a new set of tools called MOOCs that enables flipping classrooms for interactive learning. This is bringing prospects for accelerated learning that go beyond the boundaries of the traditional classroom. The digital age can help to close the gap between cities and rural practices. This is an extraordinary opportunity to speed up reforms of professional health education that can again put health professionals at the vanguard of health equity achievements. Education must not only provide the technical tools, but also the moral compass, the motivation, and incentives to be agents of social change for equity. Let's go back to the center, to the beating heart where it all begins. If we start by implementing these changes here, cultivating new visions for the newest generations, the outcome can be all-encompassing, reaching even the farthest corner of the globe. This can create real change. This is what we hope to accomplish with transformative health education.